Welcome back guys, and now we are moving towards the next one more important concept in lungs topic, that is bronchopulmonary segments. Now try to recall like what are bronchopulmonary segments. First of all, I told you in a very crystal clear manner when I taught you about the tracheobronchial tree. We are actually having like three types of bronchus there: primary bronchus, secondary bronchus and tertiary bronchus. Primary bronchus is the one which will be supplying to lung, the entire lung. Secondary bronchus is the one which will be supplying to the lobes inside that, and tertiary bronchus is the one which will be supplying to the segment. Now that itself is actually the definition of bronchopulmonary segment. So you don't have like great science here. So what is a bronchopulmonary segment? That is actually a segment, a part of the lung which is supplied by tertiary bronchus. That's all. So let's start from the scratch again. First of all, the definition of bronchopulmonary segment here, guys. So what is the meaning of bronchopulmonary segment? It is a part of lung. It is the part of the lung which is aerated by tertiary bronchus. Tertiary bronchus. Now I want you all to please write that in capital letters over there. There is a reason for that. Most of the students during the live classes I have seen, they'll be writing actually the spelling of bronchus something like this, in the doctor's handwriting. And while studying, while revising the notes, they'll be like bronchus whenever they like, bronchiole whenever they like. So please remember, it is not bronchiole, it is bronchus. Bronchus, tertiary bronchus. And the tertiary bronchus, I hope you all remember, it is also known as the segmental bronchus, another name of that. Because it is actually supplying to the segment, it is also known as the segmental bronchus, guys. Perfect. That's the definition of the bronchopulmonary segment. The bronchopulmonary segment is the one which is aerated by tertiary bronchus or segmental bronchus. Now once you are comfortable with the definition here, the next thing is what is the shape of the bronchopulmonary segment. Remember, it will be pyramidal in shape, sir. So each and every bronchopulmonary segment will be actually pyramidal in shape. And remember the apex of that, a pyramid will always have an apex. An apex of all the bronchopulmonary segment or will be directed towards the hilum of the lung. I repeat again, apex of all the bronchopulmonary segment is directed towards the hilum of the lung. So apex is directed towards hilum, towards the hilum of lungs. Now once you are comfortable with the shape, and after that we also have to know the number, like in total how many bronchopulmonary segments do we have? We have totally 10 bronchopulmonary segments in each lung. So each lung will be actually having like 10 bronchopulmonary segments, guys. So the moment you know that there will be like 10 bronchopulmonary segments, you have to know even the names of that one. And don't try to mug up the names again with the same thing, mnemonic, and every time it is like A, B, C, D mnemonic only. The best way, again the same thing, follow my style here. Let's draw a diagram for this one and the things will become easy, guys. So 10 bronchopulmonary segments in each lung. So my dear friends, draw a diagram of the lung here first of all. So imagine this one to be your right lung and imagine this one here to be the left lung. And left lung we know very well there will be a cardiac notch along with the lingula, the tongue like structure above the cardiac notch, that is lingula. So I am damn sure each and every student is like comfortable with the lung. We have like two lungs and we even know the name of that, right lung and left lung. Inside the lung it will be divided into lobes and my students are even comfortable with the lobes also. You are expert in the lobes. Right lung will actually have 3 lobes, that is upper, middle and the lower, and the left lung will just have 2 lobes, that is upper lobe and the lower lobe. Perfect. Lungs and lobes we already know from the very beginning, and now it is about the segments. Let us learn about the segments, their names, guys. Starting with the right one first of all. In the upper lobe you actually have got like 3 segments here. There will be one apical bronchopulmonary segment, and then there will be one anterior bronchopulmonary segment, and then there will be a posterior bronchopulmonary segment. There will be apical, anterior and posterior. So 3 segments will be there in the upper lobe. Comfortably done. Now after that immediately learn about the lower lobe, guys, and in the lower lobe you actually have like 5 segments. And what are the 5 segments present over here? First you will be actually having one superior here, one superior bronchopulmonary segment here, guys, and then below you will be actually having 4 basal segments. There will be 4 basal segments. I'll just write down here as 4 basal bronchopulmonary segment. Now what is the name of these 4 basal segments over here? Out of these 4 basal, there will be one anterior basal, and then there will be one posterior basal, and then we even have the medial basal, and my dear friends, then there will be a lateral basal one. lateral basal also. So, there will be anterior basal and the posterior basal, the medial basal and the lateral basal. There are 4 basal segments. Now, some of the students during the live classes are confused. Okay, sir is actually drawing only 3 basal segments over there, but while writing, he is writing 4 of them over there. Now, don't get confused with all these silly things over here. Try to understand the diagram in 3D. This is towards the medial side, the medial basal. This is towards the lateral side, lateral basal. In front, anterior, and the posterior basal is actually present behind. So, try to understand in 3D the posterior basal behind, sir. Now, once you are comfortable with this one, look at the beauty here. We have till now completed totally 8 bronchopulmonary segments. So, 3 in the upper lobe and 5 in the lower lobe, guys. 5 plus 3, totally 8 segments are done. Now, let me tell you a good news here. The good news here is that, thank God, you don't have to study all the 10 and 10 names separately. Why? Because out of the 10 segments, remember all these 8 segments that we have written till now, they are absolutely the same in the left lung also. So, even in the left lung, these 8 segments are absolutely the same. You don't have to learn it separately, guys. So, just do the same work, copy, paste. So, welcome to the left lung here. In the left lung above, there will be apical bronchopulmonary segment, and then there will be anterior bronchopulmonary segment, and then there is a posterior bronchopulmonary segment. And in the lower lobe, you will be having one superior bronchopulmonary segment, and then below you will be actually having like 4 basal. And we are not going to write down the names again. The 4 basal will be anterior basal, the medial basal, the posterior basal and the lateral basal, guys. The 4 basal segments again. So, thank God the 8 segments, the name are simple, they are the same, guys. That is the reason why I told you don't mug up with the mnemonic. If you draw this like this, things will become easier and it will become easy for you to remember the names also. So, the only thing which is left out here will be the middle lobe, and in the middle lobe, let me just write it with a different color here. In the middle lobe, there will be one medial bronchopulmonary segment, and there will be a lateral bronchopulmonary segment. There will be one medial, another one is lateral bronchopulmonary segment. Then in the left lung, actually we don't have a middle lobe over there, but here the naming is very much easier. Why? Because what is this tongue-like structure hanging over there, guys? That is nothing but lingula. And with respect to that, remember there will be two more bronchopulmonary segment here. One will be superior lingular, and another one will be the inferior lingular here, guys. The superior lingular, another one will be the inferior lingular. So, due to the presence of that tongue-like structure over there, that is lingula, because of that there will be 2 segments over there. One is superior lingular, another one will be the inferior lingular, guys. That completes all the names of the 10 and 10, 20 bronchopulmonary segments. Yes, in both the lungs has been completed here, guys, comfortably. So, we are done with the definition, we are done with the shape, we are done with their number and their names also in a very conceptual manner. Now, once you are done with this one, let's see certain important MCQs which are related to this bronchopulmonary segment, and very important ones, guys. Now, first thing which is more important here, okay, which bronchopulmonary segment will be most dependent, and we have to learn in 2 positions. One is in standing position, that is erect position, and one will be in the supine position. So, which bronchopulmonary segment will be most dependent bronchopulmonary segment in both the positions? So, please add a note there. Now, let us discuss all the MCQs related to bronchopulmonary segment. Number 1, remember the right posterior basal. I will just write it like this here, right posterior basal. Okay, right posterior basal. So, in the right lung, the posterior basal, that is the most dependent bronchopulmonary segment in erect position, or we can say the standing position, guys. So, which segment will be the most dependent during the erect or standing position there? That will be the right posterior basal. Posterior basal segment is more or the most dependent one during the erect position or the standing position. Now, what about the supine position here? Number 2, again the right side only, but this time the superior one. So, right superior bronchopulmonary segment is the most dependent bronchopulmonary segment in supine position. So, in standing position it will be the right posterior basal, whereas in the supine position it will be right superior. Right superior will be most dependent during the supine position, guys. Now, after this one, after these 2 points here, next point and the most important one, and let us discuss this one in detail here, guys, with the help of a diagram here. Welcome to the note number 3. Now, for example, you imagine here this is one bronchopulmonary segment here, and this one will be another bronchopulmonary segment over here, and just for the sake of understanding I am drawing like one more. I told you already the bronchopulmonary segment will be pyramidal in shape. So, this is bronchopulmonary segment, and this is also like another bronchopulmonary segment. And each and every bronchopulmonary segment, they are separated by a septum in the middle, and that septum is actually the extension of visceral pleura only. That is very much important, guys. The visceral pleura is actually going to cover your lung, and it is very much adherent, attached to the lung, and that visceral pleura itself is the one which is going to come in between the segments and separate them apart. Okay. So, between the segments you will be having a septum, and that septum is formed by visceral pleura only. Keep that in mind. Now, let me just elaborate and draw the diagram of one of the bronchopulmonary segment in detail. Now, what is the definition here, guys? Each and every bronchopulmonary segment is supplied by what only? It will be supplied by the tertiary bronchus. So, imagine this one here to be the tertiary bronchus here. Be very careful with the name there, guys, tertiary bronchus. So, each and every bronchopulmonary segment is supplied by tertiary bronchus. I am not drawing the diagram for each and every one, just try to manage here. So, we are drawing the diagram only for one bronchopulmonary segment. So, there is a tertiary bronchus, and after that you have bronchiole, and then further you will be actually having that alveolar duct, the sac, alveoli, and all those structures, guys. Now, what is the artery which will be supplying the blood to this one? And here most of the students are confused. Why? Because we actually have got like two categories here. One is bronchial artery, and another one will be the pulmonary artery. Bronchial artery and pulmonary artery. Now, let me give you the clarity here itself regarding the blood supply, so that you can understand and remember very easily and very conceptually here, guys. Remember, bronchial artery will supply the blood only and only up to respiratory bronchioles only. Bronchial artery, let me just use a red color here for that one. So, bronchial artery is actually going to supply the blood only and only up to what? Up to the respiratory bronchiole. Respiratory bronchiole. Don't worry about that, I will make you write down. Then automatically the question comes in our mind, okay, then sir, what about the remaining structures then after respiratory bronchiole? After respiratory bronchiole, like alveolar duct, alveoli and all, there the blood will be actually carried by pulmonary artery, guys. And be very careful here, don't get confused with the colors here. Remember, it's pulmonary artery. We are drawing in blue color. Why? Because it is the one which is going to carry deoxygenated blood there. But still remember, it is a pulmonary artery there. I am drawing in those same colors. Why? Because it was given as an image based question. Exactly the same image was given in the exam. And for the sake of easiness, if I draw the same diagram right now in red color in the exam, you will be getting confused with that one. So, let us follow the same trend, and if it comes in the exam, you will not at all going to get confused, guys. So, tertiary bronchus, and along with that bronchial artery, but remember, bronchial artery is supplying the blood only up to respiratory bronchiole, and then pulmonary artery is the one which is taking care of the blood supply after that, after the respiratory bronchiole part. Perfect. Till here it is perfect. But sir, what about the pulmonary vein? What about the pulmonary vein? Where do we have the pulmonary vein here? Do we have a pulmonary vein individually for each and every bronchopulmonary segment? Absolutely no. You will be actually having the pulmonary vein in between the segment over here. The pulmonary veins are actually present in between the segments. They are intersegmental. They are actually intersegmental. And that's the reason why there was a beautiful question asked in the exam. Why can't these bronchopulmonary segments be called as bronchovascular segments? Why can't we call these bronchopulmonary segments as bronchovascular segments? Why? Because yes, they do have pulmonary artery, but they don't have a pulmonary vein individually. Separately they don't have. The pulmonary vein is like intersegmental, and it is going to drain multiple segments there, guys. I repeat again, pulmonary vein is actually in between the segments, and it is actually going to drain multiple segments. There is no individual pulmonary vein for each and every segment. That is the reason why those segments are not known as bronchovascular. You cannot use the word as vascular. That is why the name is bronchopulmonary segment, guys. Let's make a note of this very clearly. Already has been tested in the exam. Very important, guys. So, each and every bronchopulmonary segment has tertiary bronchus and pulmonary artery individually. Tertiary bronchus and pulmonary artery individually. But pulmonary vein is intersegmental. Pulmonary vein is actually intersegmental. Now, because of this reason only, therefore, bronchopulmonary segment cannot be called as bronchovascular segment. Bronchovascular segment. Already this has been tested in the exam, asked in the exam, guys. So, why cannot called as bronchovascular segment? If it is asked again in the exam, your answer has to be yes. Why? Because the pulmonary vein is intersegmental. So, because the pulmonary veins are intersegmental, that is the reason why you cannot call that bronchopulmonary segment as bronchovascular segments. That is important here, sir. Perfect. That's one beautiful concept to be remembered about. And after completing this concept, let me do one thing here. Let me even teach you, or let me even tell you some important points regarding the bronchial artery also here itself, so that we don't have to learn it again separately, guys. Okay, so let us just write it like note number 4 here, and in the note number 4, let's learn about the bronchial artery. First point that you all have to know is bronchial artery will be supplying up to where? So bronchial artery supplies up to, the bronchial artery will be supplying up to what, guys? Up to the respiratory bronchiole. Respiratory bronchiole, first important point. Then second important point that you have to remember is that how many bronchial arteries do you have for right lung and how many bronchial arteries do you have for left lung? Even their numbers will differ. So remember, for right lung you actually have only one bronchial artery, and for the left lung you actually have two bronchial arteries. There is only one bronchial artery for the right lung, whereas there are two bronchial arteries for the left lung. By the way, what is the source of that? These arteries are the branches of what? They are coming from where? Remember, for left lung, the two bronchial arteries are directly coming from the aorta. No doubt about that. It's descending thoracic aorta. Descending thoracic aorta. Left aorta already, I think you can just use that same thing in your mind to remember. I'm just telling for the sake of remembrance, guys. Aorta, arch of aorta, taking a turn towards the left. So keep that in mind. Left lung supplied by two bronchial arteries, and those two bronchial arteries are the branches of, they are the branches of aorta only, descending aorta. But just write that and forget about that. That's so simple that no one will ask you in the exam. Now what they will ask you in the exam is about the right lung. Right lung is supplied by only and only one bronchial artery, and that bronchial artery will be a branch of which one? It is a branch of right third intercostal artery. Third intercostal artery. Right third intercostal artery. That's important. And intercostal artery is again coming from where only? It's again coming from the aorta only, guys. So remember, it is about the right third intercostal artery from where you are getting that one bronchial artery towards the right lung. So left lung is supplied by two bronchial artery, right lung is supplied by only one bronchial artery. Now just add one more important information here, guys. Note number 5. Right lung will be mostly having 10 bronchopulmonary segments in most of the people, but whereas the left lung will be having only 9 bronchopulmonary segment. 9 bronchopulmonary segment in most of the people. What is the reason? Why it is like this here? Why? Because, yes, just recall the names. Just now I have taught you all the names of the bronchopulmonary segments here in this diagram. Now in the left lung, what is going to happen? There will be a cardiac notch, and that cardiac notch is actually for accommodating your heart over there. And to accommodate the heart, what is going to happen? The medial basal segment, will be most probably absent. So this has been asked many times in the exam, and it's so simple. Okay, why do we have like 9 bronchopulmonary segments in the left lung? To accommodate your heart, the medial basal segment here will be absent here, sir. So medial basal segment will be absent. So in most of the people, right lung will be having 10 bronchopulmonary segment and left lung will have only 9 bronchopulmonary segment, and the reason for that is medial basal segment is absent, so as to accommodate your heart over there, guys. Now sometimes what will happen is, in some of the books, I think you have even come across a question which says that in the left lung you have got only 8 bronchopulmonary segment. Then what, sir? What is the reason for that one? Again, come back to the names here, guys. Don't get confused. I'll tell you the final conclusion also. If you're having like 8 bronchopulmonary segment, what is the reason? Sometimes what will happen is, let me use another highlighter here. Sometimes what is going to happen, the apical bronchopulmonary segment and the posterior, these two are fused together. You don't have like two separate segments over there. Those two are actually fused together, the apical and the posterior. So apico-posterior bronchopulmonary segment, apico-posterior bronchopulmonary segment, they are fused together. So if they are fused together, then how many will be there in that one? Then it will be 8 of them, but not always, sometimes. So therefore, sir, it's like I'm confusing you. I told you left lung will have 9 segments as well as like 8 segments also, and in the very beginning I even told you there will be 10 segments also. Now what is the best answer? If this question comes in the exam, what is the best answer? So remember, most commonly there will be 9 segments in the left lung, 9 bronchopulmonary segments in the left lung. That answer is more better when compared to the 8 segments, and that answer is more better when compared to the 10 segments. That should be the sequence in which you have to remember about the number of bronchopulmonary segment in the left lung. So 9 segments will be more better answer when compared to the 8, and that is more better when compared to the 10 segments, guys. That's the final answer. Next, last and final thing, one more thing which is important. I hope you are understanding the importance of this topic right now. On the left hand side, let us write down the name of the organ, and on the right hand side, let us write down the number of segments. Just now we have learned lung. Lung will be totally divided to how many bronchopulmonary segments, sir? 10. And then liver we will be learning in the abdomen topic, and in the liver they'll be totally divided into how many segments? 8 segments. I think you have learned in surgery also, according to Connaught's classification, liver is divided into 8 segments. And finally kidney, and kidney will be actually divided into 5 segments. I want you all to remember this number of segments. And before ending this one, I would like to tell you again, my main focus, my main intention here, what I am trying to put in your mind is segments, that word segments. Now don't get confused guys, liver will be actually having like 2 lobes. No, I am not speaking about the lobes, I am speaking about segments. I have seen some people even getting confused in that silly things also guys. So lung is divided into 10 segments, liver will be divided into 8 segments, and whereas the kidney will be divided into 5 segments. And don't worry about the liver and kidney, we'll deal with that in detail in the abdomen topic. So that's all about all the bronchopulmonary segments in the lung, and I have made this easy to remember the names and everything with the help of this simple diagram over here guys. So I hope this topic is crystal clear now. That's all, done. Thank you.